think one of the innovations could be that in some of the poorest countries that have poor EPI, we could do mass campaigns in young children to induce herd protection and therefore protect the youngest from pneumococcal disease. In other parts of the world, it's key that we try to make vaccines more affordable, and there are other interesting options like reducing the number of doses.
Right now, it's only affordable by a small proportion of people. The vast majority cannot even afford that. So it's not going to help them even if the vaccine is available in that market.
Essentially, the distance, the town of the village, and also of the health center.
The second barrier maybe would be the mentality of the people. And these are the most important things.
So in the Serenade study, we saw that globally, PCVs and infant immunization programs have greatly reduced disease for both young children, but also unvaccinated older children and adults. However, we also saw disparities in that only about 70% of middle-income countries have introduced PCVs compared to 80 to 90% of low and high-income countries, despite having large populations that could greatly benefit from the vaccine.
One of the barriers for middle-income countries is cost, since low-income countries have access to tiered pricing and high-income countries can usually afford the vaccines on their own, but middle-income countries are kind of left in this gap where they can't usually afford the vaccines on their own and are often even left dealing with higher prices than the high-income countries who have the power to negotiate those prices. Fortunately, there is hope that the new PCV10 product by the Serum Institutes of India will help resolve this problem.
Get the message out. We need to figure out how to reach people who are living in very remote areas where they may not have access to transportation and there may not be mobile clinics available. So we need to figure out how to reach those people. And each country is different, and we need to find solutions that are specific to each situation. It needs very careful thinking and planning.
They provide countries with a year of free vaccinations through their own funders and pharmaceutical partners. In the second year, the country would pay a quarter or a half of the cost, and from then on, the country would continue to pay for the vaccine, while the foundation does impact studies, help with training programs, and liaises with the pharmaceutical partners.
Those countries are bearing the burden of infectious diseases, and ultimately that affects their productivity and things like stability of economic stability of the whole world. And so we need to hold up our end to contributing to these programs to distribute these vaccines, reducing child mortality, increasing the quality of life and economic productivity, and we will indirectly see the rewards of that.
Because an issue is not to start a program, but to fund the program over several years. And it's important to have a system that will convince public health authorities and politicians that this program is worthwhile in terms of prevention.